Hello everyone, good morning. Today I would like to present about Autism Spectrum Disorder and Asperger syndrome. Now I'm going to start with Autism Spectrum Disorder. Autism Spectrum Disorder, also known as ASD, is a range of neurodevelopmental disorder that's typically characterized by challenges with social interaction and communication, repetitive habits, interests, and others. Onset for ASD is typically before 3 years old, and the condition stays throughout the entire life. According to some studies, ASD prevalence rate is estimated to be at 6 per 1,000. According to an estimation by CDC, approximately 4 times as many boys as girls have autism, which means more boys have autism compared to girls. Autistic children can be found in most of the families, regardless of race, religion, more. ASD range from many disorders, which include Asperger syndrome, autism, and many more. Okay, what is autism? Autism, also known as autism spectrum, which is known as ASD, refers to a wide range of diseases that affect how the brain develops. Autism also coexists with other neuropsychiatric disorders, which include seizures, Tourette's syndrome, and many more. The diagnosis of autism depends heavily on disorder's behavioral traits. The traits are categorized into 4 subclusters of disturbance: social interactions, communication, behaviors, and sensory and perceptual processing associated impairments. I will start with the first subculture, disturbance in social interactions, which can affect the child's ability to form meaningful relationships with humans and objects. The common behavior include poor eye contact, not proper facial expression, more. Second one, disturbance is communication, which can range from mild to severe continuity. For the mild one, normal language with slight expression or tonal deficits. For the severe one, is a lack of speech, which is also known as mute. Most of autistic children's speech is echolalic. There are 2 types of echolalia, classic and deferred. Classic echolalia refers to parrot-like phrase repetition immediately after the child was exposed, while the deferred echolalia refers to phrase repetition at a later time. Now, disturbance in behavior also is mostly seen in the inadaptability to routine changes, stereotypical behavior, and many more. Also includes strange connection to unusual objects like interest in paper, chair, and many more. Behavior disturbance also includes deviation from common motor patterns. Deviant motor patterns include both lower extremities, legs and more, and upper extremities with arms and more. Common deviant motor patterns include wiggling fingers, toe walking, and many more. And the last and final disturbance with sensory and perceptual processing and associated impairments. These subclusters have been reported in autistic children for almost 40 years, which includes abnormal response to assorted visual, vestibular, and auditory stimuli. To be precise, autistic children are extremely sensitive to sound and might have difficulty to adjust to everyday life, everyday sounds. Associated impairments include seizures, intellectual impairment, many more. The fact that most of the autistic children suffers from cognitive defects has been accepted, although it's controversial. Autistic children who shows cognitive defects significantly change the potential outcomes and may result in permanent disability. Now, for autism, the functional prognosis for autistic children varies despite the fact that they often live normal life. Some people with high functioning autism live and work independently in the community. Some are fairly independent who only need little support, and the rest all depend on family and friends. The prognosis for kids on autistic spectrum is typically closely correlated with IQ and communication abilities. High functioning autistic children may become high functioning autistic adults in social interactions in the future. The optimal management for children with autism is a comprehensive strategy that includes parental counseling, behavioral treatment, social skills, training, medicine, and many more. Numerous therapies, which include music, occupational, and many more, have been promoted. In general, autistic children tend to respond to highly structured, specialized education programs like IEPs, according to some studies. Now, coming to the Asperger syndrome. Asperger syndrome is a form of development disorder often related with autism spectrum disorder. It can be distinguished from autism by the fact that children with Asperger's do not exhibit clinically significant delays in language. That means the language is very good. Children with Asperger's syndrome tend to show typical cognitive development and age-appropriate self-help skills. Although the language skills are age-appropriate, which is good, individuals with Asperger syndrome shows peculiarity in verbal communication, which is characterized by one-sidedness, failure to convey a clear short thought, and many more. And people with Asperger syndrome also tend to show a poor understanding of others since they lack non-verbal communication and empathy. According to some epidemiological studies, this syndrome is 5 times more prevalent in boys, which compared to girls. Treatment for this disorder currently consists of supportive systematic intervention, which includes language training, vocational training, and others.